Hello, you are most welcome, ladies and gentlemen, to Power Behind the Voice on Tuesday Night Anatomy with Daniel Okwan. Now, today's section, I want to talk about a metabolic condition actually relating to carbohydrate metabolism, and that is diabetes mellitus. Now, for diabetes, yes, it is having high morbidity and mortality. Yes, globally, about 422 million people are affected by this metabolic condition, and then roughly 1.6 million people visit their grave as a result of this condition. So it is worth mentioning and it is worth discussed. Now, the reason why I want to talk about it is that yes, it has some anatomical basis, and the reason is simple. In the abdomen, yes, retroperitoneally, there is this organ over there being the pancreas. Now, the pancreas, yes, is a maize gland, actually having both exocrine portion as well as endocrine portion. Now, the exocrine portion is essentially going to produce, secrete these kind of digestive, secretions, rich in, of course, enzymes for the various chemical digestion of food. But for the endocrine aspect, the endocrine aspect by way of having this islet of Langerhans. Now, this islet of Langerhans will contain cells, notably, yes, alpha cell, or beta cell, or delta cells. But I'm interested in, of course, the beta cells. Now, the beta cells of the pancreas will produce or will secrete what we call insulin. And insulin is very important, yes, in ensuring that anytime you eat and your blood sugar level or blood glucose level begins to rise, then what happens is that insulin is secreted, maximally into the blood, to ensure that the cells of the body pick up this kind of glucose, so that they will utilize it. Apart from that, of course, the liver will also pick up the glucose and store it in the form of glycogen. The same applies to, of course, the muscle cells. So these are what, of course, the insulin is going to do, ensuring that blood sugar level is actually brought to the barest minimum. And what do I mean by barest minimum? Ensuring that yes, there is homeostasis of blood glucose level. And we mean that normally for individuals, for normal adults, we expect that blood glucose level should be around 3.6 up to about 6.1 millimole per liter. Now, for these values that I'm going to talk about them, I'll be mentioning some values. All of them will be in millimole per liter. Now, if you want to convert them to milligram per deciliter, then all you need to do is to multiply the value by 18, to get the equivalent value actually. So what we are saying is that yes, the pancreas is playing an important role by way of the beta cells secreting insulin. And insulin, once insulin is secreted, gets into the blood, it has to get some receptors to bind onto, so that it triggers that kind of cascade of reaction, ensuring that glucose enters the cell. Glucose is transported into the cell. Now, if for instance insulin is produced and the cells are insensitive to this glucose by way of having the receptors receive them, then what happens is that the same physiological effect won't be manifested. So diabetes is two things: either you are not secreting enough insulin, or you are not secreting it at all, or you secrete it but the cells which are supposed to respond to this insulin by, of course, acting appropriately are insensitive to it. So that is why we say that we have two main kinds of diabetes. Diabetes mellitus. So these two main kinds will be one, the type 1 diabetes. Now, for type 1 diabetes, roughly we expect that it affects roughly about 10 to 15% of the population. Now, usually its onset is juvenile, at young stage. That's when it tends to manifest 14 years, less than 40, or even less than 20 years. That is when normally it tends to manifest itself. And this one, we may have even type 1. Now, if we say type 1, it means that the problem is actually dependent mainly on insulin secretion. So we say type 1 is insulin dependent diabetes type. Such that there is disorder regarding the release of insulin from these beta cells of the islet of Langerhans. So it's either through autoimmune destruction, and that is the type A, or it could be idiopathic. We can't really explain it. Okay, it could be idiopathic. Now, all these things we are talking about. So if it's autoimmune, then it means that yes, the body self, okay, the body itself is making antibodies against its own, beta cells, so that beta cells are destroyed. In effect, yes, hyposecretion of insulin. Okay, so that's one thing that we have to know. Now, the important point here is that yes, there will be genetic bearing which will take place. Okay, so genetics may play a role. Even sometimes even the environment, okay, may play a role. Okay, some kind of viral infections that one might have gotten exposed to may trigger this autoimmune condition. Okay, so that's an important thing that we have to know. But more importantly, what happens is that rarely, although yes, we say that overweight could play a role, rarely doesn't really account for this, for the type 1. Okay, so if you have a family history too, yes, it may run in the family. If you have a very close relative suffering from this type 1 diabetes, you may also most likely suffer from it in some time in your lifetime actually. Now we also have the type 2. Now for the type 2, we say it is insulin independent. Okay, insulin independent, such that yes, the body, there's no autoimmune destruction of the beta cells, therefore beta cells are able to produce this kind of insulin adequately into the blood. Only that yes, the receptors of these cells are insensitive to this insulin, and therefore so there will be increased blood glucose level, such that there's enough glucose in the blood, but the cells are insensitive, and therefore they can take up this glucose and use it to generate energy for the body. Okay, in that same vein, yes, there's increased blood sugar level or blood glucose level, and that's also diabetes form. That's type 2 diabetes. Okay, now what will account for this insulin insensitivity? Mainly it is attributed to overweight, and I mean obesity, or more importantly morbid obesity. Okay, if you gain too much weight, then your cells become insensitive to this insulin that we are talking about, and for that matter, glucose will be a lot in your blood, and your cells will be starving, okay, of this glucose which they need to generate energy for you. So it means that it tells you that one of the symptoms or signs that you will find with someone with diabetes is that yes, fatigue will be a common phenomenon. Okay, because the individual is not unable to generate energy from the food he or she has eaten. They are in the blood, a lot of burden to the blood, but the cells are getting starved. Okay, and for that matter, yes, fatigue is likely to set in. So for type 2 diabetes, the problem is not insulin production, but the problem is that the cells are insensitive. So it means if you are obese, if you are physically inactive, if you have a family member with the condition, then most likely yes, you may also suffer from this. Okay, that is why we are advised to, of course, be physically active. Of course, try and then reduce our weight to the barest minimum. Okay, so that is what we are talking about. Now, having seen these ones, now even for the type 2, usually it affects individuals after the age 30 or 40 years. So the more you age, the more the chances that of course you'll be less physically active, and for that matter, the more the chances that of course you may suffer from type 2 diabetes. So that is what we have to know. Now for this same type 2 diabetes, sometimes individuals who get pregnant, okay, because of the placenta actually producing what we call human placental lactogen, then what happens is that this human placental lactogen tends to antagonize the action of what we call insulin. Yeah, the reason is simple, because they want to antagonize it so that the cells of the mother will make use of a lot of the glucose, okay, so that the fetus will get a lot of the glucose, okay, for its energy requirement. So if that persists, actually what will happen is that there's something we call gestational diabetes. Okay, gestational diabetes. But usually, for most cases, yes, after delivery, what happens is that yes, the individual returns to normal glycemic states. Okay. Now, let me tell you something, that yes, we are talking about blood sugar level, okay, and we test all these things in the laboratory in the hospitals, what happens is that if you are having low value, it's also a problem, and that's what we call hypoglycemia. If you are having high value, and that is what we are talking about, if it is high value and it is chronic, and that's what we are talking about, diabetes mellitus. So chronic hyperglycemia, of course, chronic, increased blood sugar level, that is what we are talking about, diabetes mellitus. Okay, so we can look at, of course, the gestational diabetes as a result of increased human, placental lactogen. Okay, it may lead to that. Now, one key thing over here is that yes, all these things may actually have some kind of, there is some kind of general, signs and symptoms that you may see, which will tell you that yes, I'm having diabetes, or there's that chance that I may have diabetes. And these things are very simple. There's going to be something we call polyphagia. Okay, now polyphagia means you want to eat a lot. Why do you want to eat a lot? Although you're taking in some food, yes, glucose in your blood a lot, but the cells are insensitive, or insulin is not produced. So it means that yes, there's enough, glucose in your blood, but the cells are unable to make use of it. So you feel, hunger, and therefore you want to always take in food. And that is why you may see, one of the cardinal, signs will be polyphagia. Now, apart from that, there's going to be what we call polydipsia. Urea. Okay. Now, polyuria means that you are going to urinate a lot, and the reason is that yes, glucose is osmotically, very active, and therefore you want to actually, pass out a lot of urine. Wants to actually come out of the body, but as it comes out of the body, yes, it comes with a lot of water. Okay, now the next point is that because you are losing a lot of water through the urine, as well as of course the glucose coming out, it will also lead to what we call polydipsia. So polydipsia, you want to take in a lot of water because you've lost a lot, you become dehydrated. Okay, so that's what we are going to see. Now, seeing all these things, I talked about fatigue as well, but one important thing is that there are some complications that are associated with this, metabolic condition, and that is what is even more deadly. So we have what we call cardiovascular complications. Importantly, we have the vascular conditions, large conditions such as, with heart conditions, having heart attack. Okay, for instance, having stroke, cerebrovascular accident. You may have all these ones. Okay, and you may also have what we call microscopic, microvascular conditions. And for microvascular conditions, we are talking about, of course, talk about, amputations. Okay, so you may have some kind of erectile disorders. Okay, you may have some tinglings, neuropathy here and there, so that yes, there will be the need for perhaps amputation, especially when you suffer from some kind of infection. Okay, or you may get some kind of wound, and there's, let's say, secondary bacterial infection. Because there's going to be secondary bacterial infection, the bacteria are going to thrive, okay, on the sugar in your blood, in your body. So they will be able to survive a lot, and of course, cause that kind of serious damage, okay, such that the wound may fail to heal, and there may be the need for amputation. Now, of course, neuropathy will also be a very important point, such that there will be tingling, there will be numbness, especially at the extremities. Okay, even apart from that, with the neuropathy, importantly, it may lead to, of course, erectile dysfunction. Okay, especially in males. Okay, in males, of course. Then, talk about, other, complications. There could be something we call nephropathy. So for nephropathy, because there's a lot of, sugar going into the nephron being filtered all the time, yes, there's going to be that kind of nephropathy, and therefore may lead to end-stage renal failure. Yeah, that one may happen. Yes, of course, talk about retinopathy, yes, inside the eye, and that one may even lead to blindness. So as far as diabetes is concerned, it's not even just, the ordinary, cardinal signs that we are talking about, but the metabolic, complications that are associated with it makes it even more dangerous. Okay, now, for now, what we have to actually know is that now, if I'm presenting with the basic signs and symptoms, or even if I'm not presenting with any symptom, then what should I do? Now, importantly, you have to visit the hospital and you have to do some tests. Now, I told you that now for the test, what happens is that usually a day before going, for instance, if I'm supposed to go tomorrow, then around 8 p.m. today, I won't eat. Okay, wait until, of course, the following day, so that perhaps around 8 a.m. I'll go and get a test done. So roughly, you have to fast for somewhat, 8 to, let's say, 12 hours. Okay, so that you get the test done. And then some people, because they know they are going to do the test, they may want to, stay away from, of course, carbohydrate food or sweets. And that is not the case. You have to take in the food that you normally eat so that you can get true reflection of what happens inside the body. And that is where I want to say something. That there is this misconception that if you take in sweets, you may suffer from diabetes mellitus. That is not the case. Because from what we talked about, from the risk factors that we talked about, in fact, taking in sweets doesn't, predispose you from developing diabetes mellitus. But rather, if you are diagnosed of, for instance, pre-diabetes, which I'll come to very soon, then it tells you that yes, you are, getting closer to suffering from, diabetes, and therefore you have to, take very good care as far as, taking in sweets and other things are concerned. But taking in sweets will not cause, of course, diabetes mellitus. Okay, of course, mainly your lifestyle, of course, genetics, having a family member, they are the main risk factors which will, of course, be potential to, leading to this metabolic condition. So now what you have to do is that, yes, there are tests, and the tests we have what you call the fasting blood sugar. I'm going to recommend just 3 tests today, and then we will end it here. So we have the fasting blood sugar. Now for fasting blood sugar, we expect that it is around 3.6 to, of course, 6.1 millimole per liter. Some peg it at 6.3 millimole, but I think if you make it 6.1 millimole per liter, that's actually very ideal. Okay, this is the normal blood sugar level. Now if it goes beyond, okay, it gets to somewhere less than, let me say 6.1, above 6.1, up to, let's say, 7.0, then it means that yes, you are likely within what we call pre-diabetes. Now for pre-diabetes, we have 2 kinds. Okay, we have what we call individuals who are just going to have impaired fasting blood sugar level, and then we have individuals with intolerance to what we call oral glucose. So I will explain that one. Okay, so it means that yes, if you are in pre-diabetes, your glucose level may hover around 6.1 or above 6.1 up to, let's say, 7.0. Okay, then it tells you that yes, quickly you have to try and adjust your lifestyle. If you have to exercise, you do so that you, of course, you minimize this kind of potential to lead into diabetes proper. Now, individuals whose blood sugar level goes beyond 7.0 millimole per liter, then it means that yes, they are actually in diabetes. So one key thing over here is that there are some people, they may not present with any sign or symptom. If you are presenting with sign or symptom, okay, regarding what we've talked about, then it means that if your blood sugar level is around more than 7.0 millimole per liter, then it tells us that yes, that's diabetes. But if we are not presenting with signs and symptoms, then we have to go on to do what we call oral glucose tolerance test. Now for oral glucose tolerance test, normally you take, let's say, roughly 75 grams of course, the glucose, manufactured glucose, of course, in about 100 mils of potable water. Okay, then you take it in. Now roughly in about some hourly interval, you may be required, okay, to check your, of course, your blood sugar level, your blood glucose level. But importantly, what I'm interested in is around 2 hours after you've taken this oral dose of glucose load. Okay, so what happens is that if we take it and we check the value, and the value is, of course, less than 7.8 after 2 hours of taking this load, and the value is less than 7.8 millimole per liter, then it means that, of course, you are having normal, glucose tolerance. It means you are normal. Now, individuals whose will be around, above 7.8, or in fact, 7.8 or more, up to about 11.0, then we say that they are having impaired glucose tolerance. Okay, so if you are having impaired glucose tolerance, then it tells us that yes, you are in a pre-diabetic state. Okay, you are in a pre-diabetic state. Now, for individuals who have more than or equal to 11.1 millimole per liter, then it means that they are suffering from diabetes. Okay, so that is how we are actually able to diagnose this diabetes, such that perhaps you may do the normal fasting blood sugar level, blood glucose level, and the value will be in a pre-diabetic state. Now, after doing it and it goes into more than 11.1 millimole per liter, then it means that's diabetes actually. Now, there's another test, but that one, it is recommended for individuals on therapy, individuals who are taking, their diabetic, medication. So individuals who are, diagnosed with diabetes, frequently they will be required that perhaps every 3 months or every 4 months, they will be required to do this, what we call glycated hemoglobin. Okay, so they have to check their glycated hemoglobin concentration to see if, of course, they are actually adhering to, of course, their medication, or if they are responding, very well to their medication. Okay, then they have to do this glycated hemoglobin. And the reason is that for glycated hemoglobin is able to, give us, the history regarding the blood sugar level over roughly 3 to 4 month period. Because glycated has to do with hemoglobin, that portion of hemoglobin which is attached to sugar. Okay, so we expect that normally it should be less than 5.5 percent. But if it goes beyond 5.5 up to about 6.4, then we say you are in pre-diabetic state. However, if it goes more than or equal to 6.5 of course percent, then it means that you are actually suffering from diabetes. So ladies and gentlemen, for this section, I want you to know that diabetes is not caused by merely taking in sugary food. Taking in sugary food will have to be minimized in situations where that you are in a pre-diabetic state. For diabetes, get to know that yes, the main organ which is suffering or which is implicated here is the pancreas. So the islet of Langerhans 8 beta cells, yes, may not be producing this insulin, which will influence, of course, the entry of glucose into cells. Or it could be as a result of being overweight, being obese, and therefore your cells being insensitive to this glucose, to this insulin, and for that matter you are not able to take in this glucose into your cells. So I hope you find this helpful. In future we'll look at other dimensions regarding other metabolic conditions. May God richly bless you. May you have a good night.